All right, good evening. Welcome, everyone. I'm going to start. Sandy, if you could just give people an understanding of how the webinar is going to work in translation.
Yes, so welcome everyone to what you need to know about the COVID vaccine. It's a town hall for underserved communities. We're hosting it here at Westside Regional Center. So before we get started, there's a few things you should keep in mind. So because we are providing this town hall in English and Spanish, we are asking you to please select the language that you choose to listen to. So in your Zoom controls, whether it's, for example, if you're viewing it on your computer or if you're viewing on your phone, there's three little dots. If you can please click on the interpretation globe. And then once you click on it, if you can please select your language. So if you want to listen to this town hall in English, select English. And if you want to hear this in Spanish, please select Spanish. So throughout this town hall, you have the opportunity to ask questions, and in certain sections, we'll be asking the questions out loud. So if you don't want to ask a question out loud, but you want to submit it through our Q&A box, so on your screen or on your phone, you should see an icon that says Q&A. What you want to do is click on it, and then you'll be able to ask a question and you submit it. And then myself and Janine will be monitoring the Q&A box. And as they come in, we'll be asking our panelists. If you want to ask your question out loud to our panelists, you can go ahead and click on the bottom where you see it says participants. Then you want to raise your hand. So it looks like this. And then you'll see a prompt that would say that the host will like to unmute your microphone. So you can unmute yourself, and then we'll be able to allow you to ask the question out loud. Or if you're listening to us on your phone, what you want to do is dial *9, and then you'll be able to ask us your question. So welcome, and Tom, you're up.
Thank you very much, Sandy, and thank you for facilitating tonight and everything that you've done to get ready for this. I also want to thank our interpreters who are always great, and I'll try to not speak too fast. I'd like to welcome everyone tonight. This is, I'm sure everybody has gone to different town halls and different information. I'm very excited because I've got a great panel here to help me to talk about the vaccination. One thing that I want to preface, we're going to give you the latest information that we have. So you'll see some of the slides that are literally dated today. And what I've learned about, kind of responding to the virus and the pandemic over the last year is that things change literally day to day, sometimes hourly. So the information that we get is constantly being updated. We are doing the best that we can at Westside Regional Center to ensure that all of the latest information as far as access, accessibility, the tiers, who's eligible for the vaccines, all of that is on our website and on our social media so that you can kind of see the latest information. And I also have been trying to put out regular newsletters to kind of help inform our community, because it is confusing. There's a lot of information and it's constantly changing, and it is very confusing. So tonight with me to kind of help talk about the vaccinations, I'm very excited to welcome Dr. Lavisa Badi. She's a physician. She's an associate professor at the UCLA School of Medicine, attending at Cedars-Sinai Division of Infectious Diseases. And she's also a physician consultant at Westside Regional Center, and also a physician at Achievable Clinic, which I'm sure many people are familiar with. We are very fortunate to have her as part of our community, since she is an infectious disease doctor. Also tonight, we have Dr. Erica Bath. She's a Director of Child Forensic Services, Associate Professor, Department of Psychiatry, and she's also the Vice Chair of Equity, Diversity, and Inclusion at the Semel Institute of Neuropsychiatry and Human Behavior at UCLA. And for those of you who are not familiar with myself, Tom Kelly, and I'm the Director of Clinical Services and also part of our Westside Regional Center COVID-19 Task Force. So Dr. Badi is going to be starting, and she's going to give us kind of an understanding of what is the vaccination, how does it work, and just to try to kind of provide some understanding. We also understand that there's a lot of uncertainty and a lot of resistance to the vaccination, that there's also a lot of cultural factors, and we've invited Dr. Bath to kind of help to address some of those concerns and some of that uncertainty as well. And then at the end, I'll be talking about, current eligibility, the tier system, kind of the latest on the ground as far as what Westside Regional Center is trying to put in place so that we can support families to ensure everyone has access to the vaccination in as timely fashion as possible. And to preface it, we've kind of received a lot of questions from the community. We really hope that we'll be able to answer most of those questions, but we will save time at the end. So if there's questions that haven't been answered, then folks will have the opportunity to kind of ask us those questions. So I'd like to start with Dr. Body. I'll hand that off to you.
Thank you very much, Tom, for the introduction. It is such a pleasure to be here. The way I structured this talk was basically to address a little bit of general information about the coronavirus and COVID and how the disease is. And one of the things that are really important is the long-term consequences of the disease. And then talk a little bit about the vaccines. I did get a list of a lot of questions, and I also, from my own experience in the hospital and in the clinic, I will try and answer most of them as we go along. So the first thing I wanted to give a little bit of general information about the coronavirus. There are other kinds of coronaviruses that we've been exposed to, in the world, and those are mostly very innocuous cold-causing viruses. This particular virus jumped species. It's most likely arose from a bat, and it basically got the ability to infect humans. And since there was no immunity to this particular kind of the virus, it was able to spread across the world as a pandemic. And basically cause very significant consequences. Now, one of the things that is important to understand about these viruses is that this is an RNA virus. What that means is that it is able to constantly change itself. And that is where the concern comes and the urgency to vaccinate comes, because we want to stop the spread. When it is able to spread and it is able to replicate, then it causes more mutations and it changes itself, so that the efficacy of vaccines is a concern with variants that occur over a period of time. One of the things that I have had a lot of questions about, if it's just like, if it's an infection and I'm young and I'm healthy, I'm going to be perfectly fine. I can just take the disease. The thing that I've been talking a lot with patients and people that ask questions is that it is the long-term consequences that are now very much of a concern to the medical community. It is what happens over the long term. People can become this chronic fatigue. There are nurses that have not been able to come back to work after 4 to 5 months after having the disease, just because they're not able to. Chronic muscle aches, chronic headaches, and also a lot of pulmonary and cardiac compromise that happens over the long term. So it is extremely important to get vaccinated. I'm going to go to my first slide and explain a little bit, because a lot of questions are around what kind of vaccine are these, how much damage can they do, are they genetic material that is being injected into our DNA? And I wanted to go ahead and answer those questions. Sandy, if you can please bring up the vaccine slide, not this one, it's this one. So this is a really nice diagram. I had it from, when the vaccines were being designed, but it explains something very simple. The reason it's called a coronavirus is that it has these spikes around it. I'm sure you've seen a million images of this. And what happens is that it's not the live virus that is injected. I'm going to kind of, in my talk, answer the kind of questions that I've had from patients. about whether it's a live virus. It is not a live virus. A subunit, the part of the virus that basically makes it enter into cells, is what the vaccines are designed to work for. So there's two different kinds of vaccines that we have available in the US right now. One is the RNA vaccines, and you've heard a lot about the Pfizer and the Moderna vaccines. These are very similar vaccines. They're on a similar platform. There is a lot of questions about how was it hurried through? How did they just come up with the vaccine in so quickly? So I wanted to say that this mRNA research, the idea of designing therapeutic agents based on what we call mRNA, has been going on for about 25 years. Now, a lot of science had basically been developed, and that is what really helped us to actually move forward very quickly with the idea of designing a vaccine. So what they did was that they took the RNA. RNA is a messenger. What it does is that it is put into a vaccine. Once it's injected, it goes into cells. It does not enter the nucleus of a cell. Now, so that is, it just stays in the cytoplasm. If you go back to high school biology, you'll remember that the nucleus is where it's a command center, but the cytoplasm is where the protein formation takes place. So once the antibodies, once the virus makes the spike protein in the body, then the body generates an antibody response, which is what you see, those purple Y-shaped things. Those are called antibodies. Now, why do you need two vaccines? Because the first vaccine shot that you get is the body just recognizing, oh, that was something different. That wasn't me. That was something foreign. I need to act against it. So the body goes ahead and makes a few antibodies and kind of, gets it act a little bit together. The second vaccine is where you will actually, now the immune system of the body sees something that it is totally recognizes immediately as something it doesn't like, something that was foreign, that was introduced into the body. And then it mounts this huge immune response. So that is the reason for the two-tier dose of the mRNA vaccine. And remember that all vaccines are studied in different ways and they all act differently, but this is the way that this vaccine acts, that you need two doses. There are vaccines that work fine with one dose. There are vaccines, as you know, for example, if you get Gardasil, you as a teenager, you're going to get 2 or 3 vaccine shots. If you get a tetanus, you're going to get 1 shot. So just to explain that, vaccines are made differently based on how the body responds to them. So that is the mRNA vaccine. And the most of the common side effects that you get, the first one is just a sore arm and your body just kind of recognizing something that is new to it. The second shot is usually more significant in terms of side effects because now your body is mounting a response against something it doesn't like. Sorry about this. So it's sorry about that. It is important to recognize that the second one is the one that, I am sorry, I need to turn this off. So the second vaccine is when you would have side effects, and the side effects are basically an arm that can hurt, a lot of body aches and pains, fevers, headaches. It usually lasts about 24 hours or so, and then it goes away. So that is the reaction to the vaccine. Now, there are cases of something called anaphylaxis. Anaphylaxis is a very severe allergic reaction. And that is thought to be related to there is a coating around the mRNA called polyethylene glycol. And that coating is because RNA is a very delicate molecule, and the polyethylene glycol just makes it, stabilizes it, and makes it in a form that it can be used as an injectable. So that is what is thought to be the cause of causing these anaphylactic reactions. Anaphylaxis is treatable, as you probably all hear about people who have anaphylactic reaction to bee stings or peanuts. It is basically an epinephrine or an EpiPen that is given, and it's usually controlled. it is something that requires monitoring. Most of these reactions occur within the first 15 minutes. It's very, very rare to get a reaction, an anaphylactic reaction that is later or longer from that period of time. So that is something, that's the reason that you get monitored once you get the injection. And basically, once you're fine, they let you go after that period of time. So that is the mRNA vaccine. The other vaccine that is available now is the Johnson & Johnson vaccine. And that vaccine is an older idea. And what they take is, what they do is that they take a virus that is non-pathogenic, that doesn't cause disease, and they change the material. They put the genetic material of the virus, just that portion that produces the spike protein. So they're not putting in the coronavirus itself. They're just putting a small portion of the genetic material. And that basically, the new virus now, the virus that is non-pathogenic, now carries the ability to have the body make antibodies against the spike protein. And that is, once it's injected, your body goes ahead and makes an immune response. These are the two different platforms. Johnson & Johnson just requires one shot. One of the other questions that I've had very frequently just in the recent couple of weeks is, why is there a difference in the efficacy? There is one point that I wanted to make, that the Pfizer and Moderna vaccines were studied before any variants were available. Johnson & Johnson has been studied during the time that there are variants available, and it's been studied in and there is a high efficacy rate of greater than 85% in prevention of hospitalization or serious disease. So that is the most important thing you want to prevent. You do not want to go into the hospital with any of these symptoms or with a severe illness. So the vaccines prevent that from happening. One of the things about the vaccines, I have a Trojan horse that I actually found in a tourist. Sandy, if you could please put that up. It's actually my third slide, but I wanted to show this because this is the concept behind the Johnson & Johnson vaccine. And this is from a tourist site from the city of Troy in Turkey. So if you remember the story of Helen of Troy, these were all the soldiers that went in, and they were in this big horse. So this is exactly the kind of concept that you have to remember for the Johnson & Johnson vaccine. It's carrying a very efficacious therapeutic agent designed in this virus that is non-pathogenic, that looks perfectly fine, but inside it is this powerful carrier. So that addresses the vaccine parts. And now I want to shift gears a little bit and talk about the very frequent questions that I have had. And Sandy, if you can move to the second slide, which is so it is really important to understand who can proceed with the vaccination. So I have had these questions from people. Okay, I have cerebral palsy. Can I get this vaccine? I have HIV. Can I get this vaccine? I have hepatitis C. Can I get this? I just had cancer. Can I get this? It's really important to understand that they basically say you can proceed with the vaccination regardless of any diagnosis that you have. There are a lot of questions around pregnancy. It's a little bit not that simple to answer that question because the clinical trials did not have pregnant women. There is a study that is being conducted, but the trials didn't have it. In medicine, we have to go with evidence-based medicine when we make recommendations. So the fact that we didn't have any pregnant women makes it difficult to advise specifically. However, we do know that if a woman is pregnant and she gets coronavirus, she is at very high risk of getting very severe disease. And then the question also comes in, what are the medications that you're going to be able to use? Because we don't know from the medicines that we use, what will happen to the fetus that is at risk of all exposure to all these medications. So this is something that I've been recommending, that I personally think it's a good idea to get it, but I do recommend for women who are pregnant to talk to their own gynecologists and doctors and get their recommendation as well. So that's the same issue that goes with lactation as well. Now, another question that I get very frequently, and these were some of the submitted questions too, is what if I'm allergic to eggs? That's a very common allergy and a very common question. These vaccines are not produced in eggs. Influenza viruses, I think the reason people ask this question is because flu viruses are produced in some of them in egg cultures, but there is no egg exposure in this, so it's fine to go ahead. And this slide actually gives you really good information that even if you've had allergies to penicillin, you've had allergies to oral medications, you're not at any increased risk. The risk is there if you've had an anaphylactic reaction to an injectable or a vaccine. So over there is concern. In that case, I've been recommending an evaluation by an allergist to make sure that there is no concern there. So anaphylaxis to an injectable agent or a vaccine is a concern, but not the kind of allergies, food allergies, allergies to oral medications. That's not a concern. So that there is an issue of precaution only with the anaphylactic reactions to vaccines or injectables. Then it's important to know that what are the contraindications? Contraindications means that you shouldn't take the vaccine. So the good news with this is that there is no medical condition that is listed as a contraindication, as you can see in the red bar on the side. There is no medical indication of a contraindication. By the way, I did miss saying this, that if you are having any fever or if you're sick, it's a good idea not to get any vaccine. And that goes for the corona vaccine, virus vaccine also. If a patient comes into my office and is having a fever of 101 and cough and cold and all of that, I don't give them any vaccine. I tell them to come back when they are free of any illness. So that's an important thing to remember. There's no specific contraindication to any disease for getting the vaccine. There is a contraindication if you've had an anaphylactic reaction to the first dose of your mRNA vaccine, or if there is an allergic history, an anaphylaxis history to any of the components that go into what we think is the cause for the anaphylaxis, is the polyethylene glycol. And there's another thing called polysorbate. If you've had an anaphylactic reaction to that, then it is recommended that you not get the RNA vaccine, but you can go ahead and get the other forms of vaccines. Those are the main things. I wrote down a couple of points that I thought I wanted to address also. Is, why must everybody be vaccinated? We have to understand that this disease spreads very easily. Masking, and now we're talking about double masking. The reason for that is that this amount of disease that you have, if you have a lot of virus in your nasopharynx, which is your nose, your mouth, your upper respiratory tract, you are much more likely to transmit the disease to another person because of the amount of virus that you have. So when you get the vaccine, even if you get infected, we know that it is not 100% efficacious. It's more than 80% or 85%, but you could still get the disease, but you would get a very mild form of the disease. So your ability to infect a lot of people is less. However, if you've had the vaccine, you still need to mask because you still it's making sense. So the other thing that we need to understand is that this is a pandemic. We get vaccine not only to protect ourselves, but to protect others as well. And the most important thing that we learn about these viruses, first of all, no viral disease in the world has ever been conquered without a vaccine. We saw what a great job all the vaccines have done in the past, from measles to mumps to people used to die with those diseases, polio, all of those. The vaccines are an essential part of controlling a disease, any infectious organism. So the reason we really need to vaccinate at this time is for ourselves, it is the long-term consequences. We can get the disease, but we may be those long-term people that their lives are torn apart by the fact that they don't fully recover from this disease for a long period of time. And we have no idea how long it will go on. We know that this virus, we thought it was just a lung virus and it causes a pneumonia, but no, it causes damage to the heart, it causes damage to different organs of the body. It is a very extensive vascular organism, vascular damage organism also. And when we get vaccinated, we are preventing the virus from spreading because we are preventing variants being formed. The more people that are vaccinated, the less chance that the virus has basically an open playing field, and that it can infect multiple people, change itself so that it gets stronger and more virulent. When we vaccinate, we prevent that from happening. So that is really important, that we have a whole community and everybody that is vaccinated. So I think those are the main points that I had, and I'm going to stick around later and answer any questions. I am going to pass this on to Dr. Bath, who's going to address the issues of why there is resistance and why is it that people are still questioning asking this question as to whether they should or should not vaccinate, when we know medically that it is extremely important that everybody be vaccinated. Thank you.
Thank you, Dr. Bhatti. Next slide, please. So I think we're going to go straight to, okay. I was going to say go straight to the video, but I want to talk a little bit about this notion of vaccine hesitancy, or people have probably heard the term medical mistrust, and that this is happening in communities of color, Black, Latinx, Native American communities, and that's why they don't want to get the vaccine. And really, I think, framing that discussion in the context of historical events is really critical. So when we talk about medical mistrust, we actually have to back up and talk about medical betrayal, which is what has happened to cause this mistrust and hesitancy. And this betrayal that many Black, Indigenous, and people of color communities experience is really part and parcel of the legacy of racism in medicine, the legacy of slavery in medicine, and centuries of medical betrayal. And this is also the case for people with developmental disorders. And just to give a couple of examples to anchor this, I mean, for African Americans, many people have heard of what they call the Tuskegee study, but this is really the Tuskegee study of untreated syphilis in the Negro male. And it was an unethical study conducted between 1932 and 1972 by the United States Public Health Service and the CDC. And really, they wanted to observe the natural history of untreated syphilis, so they just didn't treat Black men with the disease, and they just let the disease get worse and worse. And so the history of mistrust, right, and hesitancy is anchored in some of these events. Similarly, there's a long and recent history of medical malpractice against Puerto Rican women. There was mass sterilization, and also of Mexican men and women. So these are part of our US history, and they are also part of a larger issue of structural racism that exists in our health and political system. And so now we are, seeing also at the same time really alarming rates of Black and Brown people coming down with the virus, having disproportionate morbidity and mortality from the virus. And so this is part of, the legacy that we have to overcome. And we're seeing that, testing is not as equally accessible in our communities for COVID-19. The hospital structures in our communities aren't as robust. What's happened at Drew or MLK Hospital compared to UCLA, and the difference in resources in these communities. So all of this contributes to the medical mistrust. But that said, it's much better and important, based on everything that Dr. Body has said, to get the vaccine. So we are here to really try to dispel any myths that people may have because of that lingering distrust, and really sort of address the importance of vaccination forthright. So I think we can go to the video now.
Black folks are doing. My name's W. Kamau Bell. There's good news out there. There's a COVID-19 vaccine. Yay! But the bad news is, as Black folks, it's hard to trust what's going on. So what do? Well, we turn to people we can trust. Black folks. But not just your uncle at the cookout. No. Actually, not him at all. I'm talking about Black scientists, Black doctors, and Black nurses. Okay, first question. The vaccine happened fast, like super fast, like Usain Bolt headed to the bathroom fast. Is that something we should be concerned about?
Having an emergency authorization for these medications was critical, but that doesn't mean any steps were cut. Anything where money could be traded off for time, that was happening. Like, money was no object. They still have all of the rigor that they use for approving any vaccine. So we can feel confident that the science is still there. The messenger RNA technology has been in development for the last 12 years. So even though you hear this thing about warp speed, believe me, that was not warp speed.
And I think the data is real. It suggests it's highly effective.
About a week or so after your second dose, the people who had gotten the placebo or who didn't get the true vaccine, their rates of coronavirus continued to climb. Whereas the people who had gotten the vaccine, it just flattened out.
What about side effects?
Soreness from the injection site.
I had a little bit of arm soreness.
Arm sore? Is that a side effect? My arm's sore right now.
The common things: soreness at the injection site, headache, fever, maybe a swollen lymph nodes.
The second dose is when there's more common, those systemic side effects.
Is this like one of those pharmaceutical commercials where at the end they talk real fast about the side effects, and it's like, you're also gonna get hair from your eyeballs and vampirism?
My sister texted me the second day after I got the first vaccine, and I remember she was like, "Are you a zombie yet?" And we just laughed, like, "No, I'm not."
So the big answer is no. And the reason being is we are not injecting the virus into your body. The vaccine is training your body.
It is making those antibodies to fight that disease. So I view it as a positive thing.
So here's a question from everybody's uncle. And since I'm an uncle, it's a question for me too. Are the drug companies just trying to get rich off this?
The drug companies will certainly get rich.
Oh, drug companies are always trying to get rich, but that's not the point, right?
That is really how a lot of our innovation happens. That is why the drug companies will spend millions upon millions in research.
Were Black and brown people a part of this process, or was it only like white folks, like NASCAR white folks?
The trials were intentionally broad and inclusive.
Yeah, Black and brown folks have been recruited for the clinical trials.
We have ensured that each of the 4 historically Black medical schools, that we are all vaccine trial sites.
Here's the big question. How much are you charging us for this vaccine?
Right now, getting vaccinated is free.
Free?
Yes, it's free.
Like free.
It will be free.
Like not even free 99.
We have not charged anyone.
Okay, should I be suspicious that you aren't charging us?
No, because there's some things that the government invests in that for the good of the people.
Taxpayers like you and I contributed to the development of these vaccines.
What if I'm not worried about getting COVID-19? Like you could say, I never had smallpox. I've never had tetanus. Why do I need the shot? That's why we give vaccines. Vaccines are prevention.
I pretty much tell people you're going to be exposed some kind of way, right? So you better be ready to fight.
And what about you? Have you? Will you?
I got my first dose about 3 weeks ago.
I have not gotten the vaccine yet, but rest assured, I'm anxiously waiting.
I definitely will be getting vaccine when my turn comes. I was scared getting it, and then after I got it, I was like, oh, well, I guess it wasn't that bad.
When the vaccine went in, I felt this intense amount of honor.
Like a lot of people, I like to get my medical information from bizarre, dark corners of the internet that haven't been vetted. Is that a good idea?
Oh dear.
Please do not continue to do that.
That is definitely not a good idea.
Unfortunately, on the internet, pretty much anyone can post anything.
There are no microchips. There's no stealing of your DNA. No, none of that is happening.
Thank you, doctors. All right, I'll let you get back to work. And thank you for allowing me to ask you these questions. Oh, but before you go, just want to let you know, your parents are super proud of you. It's all they can talk about.
Okay, you can go to the next slide. Next slide, please. Okay. I think this is you, Dr. Kelly.
So currently in our population, we have a large proportion, and obviously why we want to have this conversation and why I'm so glad to have Dr. Bath here is you can see that a large proportion of our population are Black and Hispanic, and also Indigenous and Pacific Islanders. So we have a large proportion of individuals that may be vaccine resistant and have some of these concerns. So that's really why I wanted to have the conversation, why I invited Dr. Bath here to kind of help us to sort of have a preface for it. Certainly understand, I'm very familiar with the history, and I Dr. Bath, I really like how you put it, the sort of a historic betrayal, and that's absolutely true. So, it's hard to trust institutions and government entities that have in fact betrayed you. So what's different now, I guess, is the question. And I'm going to hand that back to you, Dr. Bath.
So next slide, please. And so, basically what's different now, as you could see from that video, is that, there are many scientists who are people of color who are really, there's talks like these almost every day where we are really trying to educate our communities to give them reassurance about the importance of getting the vaccine. And so I think that video with Camus Bell really sort of highlighted well, and really to dispel some of these myths. Okay, Dr. Kelly, I'm going to turn it back to you to go over some of the demographics of our population here at Westside Regional Center.
Well, one of the things, and Dr. Bath and I had a conversation this morning, and she's going to discuss a little bit about this concept of intersectionality, is that basically multiple layers of what's the word I'm looking for, of
personal and social identities, right?
Yeah. And also that kind of create different barriers and different challenges, and also make individuals more susceptible. So we certainly know there's a lot of research that suggests that individuals with developmental disabilities are going to be at greater risk in general for underlying medical disorders, and also for susceptibilities to the virus. In our population, we have, and you can see sort of a breakdown, we have a large number of individuals with autism, with intellectual disability, and then you kind of layer that with also having different cultural associations. And then we recognize that this is, with these multiple layers, having a developmental disability, having one of these developmental disabilities, also being a person of color, there's kind of multiple layers that going to act as sort of barriers and challenges to accessing the vaccination, accessing this. And we have an opportunity right now. They are addressing the equity. And what we want to really ensure is that we have access, because we realize that the individuals that we support, because of these layers, are more vulnerable. And also they have more challenges and more barriers towards healthcare access.
And one thing, I'm glad we have the intersectionality slide. So there's a concept called intersectionality, and it's a concept that was developed by a legal scholar. Her name is Kimberly Crenshaw. And anyways, this really refers to the concept that there's no single level of oppression, right? And if you think about someone in terms of their social and personal identifiers, many times there are levels and layers of risk. So being a woman, for example, in a society that has bias against women is a risk factor for experiencing inequity and bias, right? But imagine being a Black woman, imagine being a Latinx woman, or a Latinx woman who's a trans person. And then if you layer people who have developmental disorders on top of that, you know, the differences in terms of ability, language, education, class, all of these act as levers almost that can augment risk and potentiate the experiences of inequity. And so there was someone who made a great comment in the chat that really the medical community doesn't talk about people with developmental disorders in terms of some of the different medical betrayal that they've experienced. And I would really want to echo and amplify that the population with developmental disorders, intellectual disorders, often gets invisibilized and written out of, you know, these discussions. And so when we think about just like who are people who are marginalized and why we actually need to have this discussion, not only to increase vaccination rates, but to highlight the need. Even some of the rollout plans hadn't really centered people with developmental disorders as part of that. They are a vulnerable class that needs to be prioritized and at a higher category level. So that is one of the reasons why we're having this meaningful outreach today. Next slide, please. So this is you, Dr. Kelly, I think.
Oh, I see how it is. You just keep handing it to me here. Oh, thank you very much, Dr. Beth. I really appreciate that. And I love that that video that you prefaced this with. So eligibility for the vaccine. A lot of the questions that we've received have been around the question of eligibility, who's eligible, and how they can get access to the vaccine. So I'm going to speak to that. Sandy, if you can do the next slide for me. So currently, who is eligible for the vaccine? Right now, we're at the end of phase 1B. So healthcare, everybody that's eligible, healthcare workers, staff and resident at skilled nursing facilities, long-term care facilities, individuals 65 and older, education and childcare workers, emergency services, and food and agriculture. A lot of the questions that we've had are around this question of healthcare workers. So we have independent living support, ILS workers, supported living support workers. IHSS is also one of the categories. So, you know, in-home support service workers, and then also there's sort of a caveat that has been built in there about so because a lot of people have been resistant to having different healthcare workers coming into their home to support the individuals and their family, this has fallen on family members to be immediate caregivers. And so there's kind of this gray area, and we had initially, we'd provided letters, Department of Developmental Services, Westside Regional Center had given letters. And what we experienced was some sites were accepting the letters, some sites weren't, in realistically what was happening. And So we've been having conversations at the state level with the California Department of Public Health to really kind of clarify and to get the most clear language that we can to ensure that when individuals are going out to these sites for vaccination, that they're not going to be turned away. And that's our hope. And especially coming up. Sandy, in the next slide. So on March 15th, 2021, and really have to applaud all the efforts, everybody that's advocated at the state level, because they had really changed kind of the tier system and recognized that individuals with developmental disabilities, individuals with underlying medical conditions were not being prioritized in the state. And because of that, I think the people of the state heard that, and they have expanded some of the criteria. So on March 15th, healthcare providers may use their clinical judgment to vaccinate individuals ages 18 to 64 who are deemed to be at the very highest risk. So you can see a number of different medical conditions: type 2 diabetes, severe obesity, heart conditions, Down syndrome, chronic pulmonary disease, and also including individuals that we support. If you can go to the next slide, Sandy. Or if, as a result of a developmental or other severe high-risk disability, one or more of the following applies. And so here, they're kind of opening up the discussion to include individuals with developmental disability, because there's been a lot of statewide advocacy that individuals with developmental disability are at higher risk for a number of reasons, not just underlying medical reasons, but also individuals may be more reluctant to seek healthcare, may have challenges with their language, communication skills, may not be able to communicate the severity of their condition, may not be able to access healthcare as needed, and subsequently are just at a greater risk for all sorts of different environmental barriers and challenges, as well as from a greater risk for medical conditions. So on March 15th, as a result of the developmental, they're going to include individuals within our population, which is fantastic news. And I think it's very welcome news. Now the hope is that we will, and the question is, okay, so how do we get this? And Sandy, can you go to the next slide? So one of the things that is happening right now, and like I prefaced this conversation tonight, things change literally daily, hourly. Right now we're working, I know our regional center is working with the state, and we're trying to and working with the California Department of Public Health to get a clear, concise letter clarifying COVID-19 vaccination eligibility. And our hope is that within the next week, we will be able to get it out to families. So for a family member caring for a regional center client, having a letter from the regional center, and then next week preparing for when they open up to the next tier, regional center clients ages 18 to 16 to 64. And basically these letters will serve as verification. What we're trying to work on and make sure though is that the language that we're using and what we're putting in the letters is going to ensure access to the vaccination and to the vaccination sites. All right, Sandy, you want to go to the next slide? Next slide. A lot of questions, how to make an appointment. So you're checking, obviously, you have the eligibility for vaccination, and check the type of vaccination you need. Lavisa could probably speak better to this, but I've heard questions like, do we do Pfizer? Do we do Moderna? Do we do Janssen, Johnson & Johnson? The reality is really whatever vaccine we can access at this point, I think.
Whatever you can grab, sorry, Dr. Kelly.
Whatever you can grab.
Just give your arm.
Although I will, one of some feedback that I've had from different groups and some of the concerns is that having to do, so the Pfizer and Moderna have the limitation that they require two different vaccinations. DDS is Department of Developmental Services and are having a conversation with CDPH, which is the California Department of Public Health. And sorry, you get used to in this business having a lot, speaking a lot of acronyms. So thank you for asking for the clarification. The Johnson & Johnson has the advantage of being kind of a one-shot deal. And so where you have an individual, so if you go in the first off, there's questions about accessibility, transportation, being able to get to the site. And then you multiply that by 2 is trying to coordinate both having the initial injection and the second. For some individuals, having just one vaccination may be a little bit more, may make it more accessible. The other issue is if you have a side effect. So if an individual, let's say with autism spectrum disorder, let's say they have the side effect with the soreness of the arm, or they have other side effects, they may not be willing to come back for, that may sort of set a behavioral precedent where they're less likely to come back for the second vaccination. So these are considerations that I think folks do have to keep in mind when they're thinking about scheduling. Ideally, I think we would like to, we're looking at Westside Regional Center. Last week, we had we kind of did a trial run with having a mobile site at Westside, and we were able to vaccinate. They were able to, one of our healthcare partners, Central Neighborhood Health Foundation, was able to secure 70 vaccinations, and we have a partnership with them. So they were willing to share those vaccinations with us. And we started with individuals 65 and older that were eligible that have not yet been able to access the vaccination. And it was really heartening to see. It was a very successful event. We were able to get a lot of people vaccinated, and we're hoping to continue that. Like I said, this is going to change daily. So hopefully I'm going to hear something tomorrow, and hopefully we'll continue to get more. But in the meantime, I'm really encouraging folks, if you can see on the screen, vaccinatelacounty.com or vaccinefinder.org. You can go on and make an appointment. If you don't have access or computer access, there's a phone number that we've also listed. You can also ask your local healthcare provider. So if you are able to access these community sites, the other thing that I want to inform people, it seems like because there is an understanding of issues around equity, disparity, and some of the obstacles to individuals being able to get access, they're going to be putting out individual codes. I think right now, the only site where I'm seeing it, and may expand it, is at Cal State Los Angeles. So that they're providing a code for individuals, and that individual code will grant access to an appointment, and it kind of moves you up on the line, as it were. So hopefully we've asked the state if we're going to be able to get a number of those codes, and we're trying to identify individuals that we can hopefully get those out to within the next week or so. So we're Westside Regional Center, we're exploring kind of multiple avenues. How do we have an on-site? Because we realize that there's a lot of issues around transportation. There's a lot of issues around equity and being able to kind of, and also one of the things that we experienced last week on our site is we were able to kind of get people through the line in like less than 20 minutes, because we understand for a lot of individuals, especially individuals that have a number of different behavioral difficulties, it's hard to tolerate being online for, and if anybody's heard about the experience and at the Dodger site, you could be in your car online for 2 to 3 hours, kind of waiting for the vaccination appointment. Obviously, that's going to be another obstacle, another barrier. So we're really hoping, and we're petitioning, we've made a request with the county that Westside Regional Center be considered a mobile COVID site because of all the reasons that I listed. Other questions that just kind of about transportation. If individuals have difficulties or have barriers with transportation, you can talk to your service coordinator. They're already kind of looking at and preparing a list of transportation options for individuals. So we're trying to get creative about how we can help support individuals to get transportation to be able to go to those sites. The other thing, just briefly, and it's not around vaccination, but there was a question that came up recently about personal protective equipment. We have been regularly having, and I really want to thank our Family Resource Center last week. They had a really successful outreach where we were able to distribute a number of personal protective equipment to individuals in our community. And this has been an ongoing practice. We've also been giving it to supported living providers, residential providers, really trying to get out as much of the personal protective equipment as we can. If you need that, you can contact our Family Resource Center, and some of the questions like, can they, if people can't leave the home, we've been very creative. We figured out ways to have transportation to bring personal protective equipment to folks. We figured out ways to deliver it to individuals. We've also had people come and pick it up, like I said. So we have multiple ways. We have been getting regular shipments of PPE, and if you contact us, we will ensure that you're able to access it. I'm sure there's about 15 other things that I'm forgetting right now, but again, I really want to thank our panelists for taking the time, for Dr. Body and Dr. Bath to make the time. I know how crowded your schedules are. Sandy for supporting and facilitating, and to our interpreters. At this point, Sandy, I would open it up for questions.
Are we going to discuss how to prepare for your appointment, Tom, or are we just going to?
Thank you, Sandy, for the last. I forgot the last slide here. Well, I think we kind of touched upon it, but things that you should include when you're going to a vaccination site is your proof of identity, and that you live or work in Los Angeles County. And also one of the things that I touched upon is proof that you're in one of the eligible groups. And for the individuals that we support, that's going to include the verification letter that we'll be providing. And I had a number of questions. We are going to try to individualize those letters as much as we can, but we're going to have to rely on some of the language that's being dictated to us from the state, from the Department of Developmental Services, so that we make sure that our language is consistent with the language that the Department of Public Health is really receiving, so that we don't have the experience that we had before where people were being turned away. That's the last thing we want to happen. So you want to be prepared to make sure that you have all these items. And all right, thank you, Sandy. And so questions?
Yes, so there's a question. What if you do not own a car and you are essentially homebound? The County of Los Angeles has yet to announce how they plan to handle. So I'm assuming it's more modes of transportation. I do see that Mary Lou mentioned that Access will transport eligible riders to and from vaccine sites.
So we have Access that has been transporting, and I also talked with Caesar as a director of client services. We're looking at piloting a program called Auto Driver, where we might be able to reimburse individuals. Basically, we're trying to get as creative as we can, because we definitely recognize the transportation issue. What I would encourage folks, if you're in that category and you have difficulty with access, or talk to your service coordinator, and we will find a way for you to get to that site.
There's a question if, do you have to wait until March 15th to make an appointment, or can you make an appointment right now for March 15th or a date, the 16th or the 17th?
It's a good question. And I actually, myself and Liz Spencer, who was with our Family Resource Center, we kind of went on and to see if you could go ahead and make an appointment now, because I understand, like in some of the other counties, you're able to do that. You're able to go on the site in advance, but it's not really giving you the option at this point. So you do have to wait. So I guess it's one of those things at 8 a.m. unless anybody, and like I said, it changes hourly, daily. So what I'm saying right now could be old news tomorrow. They may allow people to do, but what I tried today I was not able to see a way that you could reserve an appointment without meeting the March 15th tier.
There's a question, I think Dr. Betty may be able to answer this. If you had COVID, can you get the vaccine?
Yes. So if you had COVID, the thought is that you do have antibodies and that you're going to be protected for a while. However, we don't exactly know how long the antibodies are going to last. So certainly, if you've had COVID, you should still go ahead and get the vaccine.
Thank you. There's a question about how do I ask my caseworker or my service coordinator for a verification letter?
You would just ask, you would just say that you need a verification letter. And I mean, we're working it out right now. What we might try to do is we might just try to distribute it. I'm not sure at this point. I know that we're waiting for the language from the state. Hopefully by next week, we should have a letter, and you can just ask your service coordinator. We'll make sure to get it to you.
This one's
And
for, oh, sorry.
And I'm actually I'm seeing in chat from Rochelle, our executive director, that we will be distributing and emailing those letters. So.
Okay, for Dr. Batty, after you get the COVID vaccine, do you need to continue to get tested for COVID?
I'm not exactly sure what the question is trying to answer. Unless you have symptoms or you have a concern that you're going to be exposed, I don't really think that there's a reason to get tested. However, I think the question may be related to whether they can provide services if they need to be negative for that. The test will only tell an acute infection. So I think that's what the person that's asking the question means by that.
Okay.
If they can clarify that question.
Okay. There is a question. If Westside does have a vaccine site, how will someone sign up to get the vaccine at Westside Regional Center?
Well, what's going to happen immediately, because right now we're operating at very limited access, and I'll be quite transparent with folks. We're going to try to prioritize folks. So we're going to know individuals. Things that we're going to be looking at are individuals that have significant underlying medical complications, individuals that we recognize have significant ambulatory or transportation issues, and also individuals with significant behavioral issues. So, we're going to start there because we're going to have to prioritize, whereas other sites, mass sites are doing, 2,000 to 3,000 individuals a day. We're looking at being able to do about 100 a day initially. The hope is that we'll be able to significantly expand, and then at that point, have people we'll figure out a process for people to make an appointment. But right now, we're going to be kind of selecting on our side based on trying to prioritize the individuals that we're worried about that are not going to be able to access it for some reason.
Okay, there is a question about if you're someone who suffers from seizures, can you get the COVID vaccine?
Yes, there is no contraindication as of yet to not give the vaccine to anyone with seizures. So yes, they can go ahead and get it.
Do you know how long the COVID vaccine is effective? I noticed from the CDC site that it says that those vaccinated do not need to quarantine for 3 months if exposed to someone who has tested positive for COVID. Does this mean that the vaccine is only good for 3 months?
No, the vaccine is good for as long as the antibodies last. We don't have a very clear idea at this time of how long the protection may be. There is some concern that it may need to be a revaccine like we do for the flu, but we don't have an answer for that yet. But it does seem at this point that the immunity is lasting longer than 6 months.
So let's say that someone does get vaccinated. Would it be like the flu shot and they have to get it every year?
We don't know the answer to that yet. So remember, we haven't been vaccinating for a very long period of time at this point. The efficacy is great. We know that the immunity that is produced is great. We just don't know how long it will last. I can just qualify this by another statement that there's two arms to the immune system. There's an antibody arm, which is the B cells, and then there is T cells, which actually are a different form of the immune system that also have a role to play in the immunity. So it's a complex issue. We don't know the answer fully yet. It may be the case if there is a lot of variance, or it may be that we have adequate protection. We don't know yet.
If Janine, if you can help me, for those who want to ask their question out loud.
You. We do have some individuals who have raised their hand. The first up would be Daniel Redman. Daniel, I'm going to have you unmute yourself and you'll be able to ask your question now. Daniel, are you there? Okay, we're going to move on to the next person, Lisa Anderson. You can go ahead and ask your question now.
Okay, my next question is for Coliseum for forms. Do you know if there's an express lane for the accent for the pedestrian to be able to get through? That this way you don't have to actually wait in the line forever. And for the Coliseum, how close do they have the restrooms? Do they have the restrooms close by? So if you're actually in the exit penetrating and you're actually going through the drive-through, and you have to actually use the restroom while you're actually getting to be served to making sure that you don't have the reaction. Is there the restroom close by to the Coliseum or the Forum?
Lisa, I'll try to tackle some, what I understand to be some of your questions. An express lane, I think that's a great idea, especially for individuals that need it. The closest thing I can think to at this point I haven't heard about it, but I'm hoping that that's the way that this code is going to function, is there's a recognition that these are individuals that need greater access and ease of access. And so there'll be a recognition that they'll be prioritized to get through. My own experience, I was fortunate enough to get vaccinated, and my own experience is I started at one of the large sites, is that they did have like porta potties throughout the site because you were in your car for a long time. And I was, since I had a cup of coffee first thing that morning, I was very grateful for that porta potty I would also add. So good questions. Lisa, is there another part of the question that I might have missed? Anything that I didn't address?
Because my mom actually told me I was actually in the express lane at the other stadium. And my other question is that I actually put it in the question box. Is any of these vaccines contain the penicillin in it?
I can answer that. There isn't any penicillin in the vaccines.
what is the average? What is the average wait time that when the person actually observes you for people who haven't had any the major reactions to anything?
Yeah, let me know if I'm answering the question that you asked. So the average wait time usually is just 15 minutes. But however, if somebody's had a significant reaction to a vaccine, not anaphylaxis, but a reaction, then the wait time is at least 30 minutes. If it is a significant reaction to an injectable or a vaccine, then we recommend that you see an allergist before you get the vaccination.
Thank you. And then you actually the chat message I put on the chat because you can actually call and to make the reservation the day before as soon as you make the vaccine appointment.
Can you, so the question, can you call and make an appointment?
Okay, I just actually put it on the chat that because on the Access website that you can actually schedule schedule a next day for a drive through the vaccine site.
I think, Lisa, you're saying that in the chat box you gave us the phone number to access service, right? In order for individuals to call from 8 to 5, you know, in order for them to help you get to the vaccine, right? So I think your chat box said that if you call, and I can share with everyone, if you call 626-532-1616, that access service will drive at least 20 miles from residents to get them to the vaccine site.
Anywhere between 20 miles.
Thank you, Lisa.
And thank you, Lisa, and thank you for sharing. So I saw in the chat that you had shared that somebody had informed you, your mom had informed you that there was an express line at Dodger Stadium. So you're educating me now. So, you know, there's so much information out there and I appreciate it. So apparently there is. I also see some input. We need to organize around this and really ensure that individuals in our community get vaccinated. And I absolutely concur 100%. And so I think we need to do everything we can to make sure everybody in our community gets vaccinated as soon as possible.
There's an additional question, or additional attendee with a question. Anjanette Robinson, you may speak now.
Good evening. Thank you all for all of the information. I just would like to know, as we are encouraging families to take the vaccination, if anything just happens to go wrong or anyone happens to get sick, are there any legalities in terms of us being the ones that are kind of supporting? I just asked this because someone made a comment to me about the vaccine. It was in a joking manner, but it kind of made me think like, okay, if something does just happen to go wrong, are we responsible in any way?
Well, you know, these things get defined by case law. So I guess it's case by case. I haven't heard of any cases that have been out there where there's been, unfortunately, in our experience, I've asked for like a residential providers were kind of the first tier in getting the vaccination, is if anybody had any really adverse reactions, had any really adverse experiences, because we had a lot of really vulnerable individuals in our congregate settings that had multiple medical issues. So I was obviously concerned, and you know, at the beginning of this, you know, if we had any individuals, and a lot of those individuals that are concerned or that we are consenters for, where we had provided the consent. So it's an interesting question for me, if anybody. Unfortunately, I haven't heard of any adverse reactions, so that's reassuring in that sense. And on the liability issue, you know, that, like I said, that's case law. So if there's a case and somebody takes somebody to court, then that gets answered at that point. I haven't heard of any precedent on that. I haven't heard of any case law. My feeling would be I doubt it. I doubt that there's that. I don't know, Dr. Body, if you know anything as far as the legal, ethical, as you know, if you're a community provider and you're trying to provide care, is there like legal liability if something were to go wrong?
I think that the first of all, the important thing really is that this is something that we do for the benefit of individuals. The fact that there have been almost 70 million vaccinations that have been delivered, and there hasn't been any hugely significant signal of concern is definitely something that we can take a lot of comfort in. Now, things can go wrong with a simple oral antibiotic or on an injectable. I think that in terms of legal responsibilities, when there is clear malpractice, and I think that somebody in this case scenario for myself, I would not be willing to give vaccine to someone who had a severe anaphylactic reaction to the first dose. So I think that legal issues only come up when there is a clear idea of something that should not have been done.
Thank you.
There's another question in the chat, and we're trying to get to everyone's questions, so thank you very much for your patience. The next question is, there are some concerns about the long-term effects as it relates to fertility. Can this be addressed?
So, you know, there's a lot of things that are being questions. I don't think that we know enough at this point, or that there's any significant concern at this point, or any clear logical reason why there should be a concern. So I don't think that there can be a good enough answer to this question at this point. We simply don't know, nor is there any clear signal of concern.
There is a question about if Westside Regional Center does have a vaccination site, are they going to obtain every single type of vaccine? For example, Johnson & Johnson, Pfizer, and Moderna. For example, let's say that it was recommended that the 16-year-old was, you know, should get the vaccine, but let's say you only have Moderna, you know, would you obtain a Pfizer vaccine or dose for that individual, since according to CDC, Pfizer should be for those, you know, 16 and older?
The answer is I don't know. I mean, right now, Lavisa, I'm going to hand over the question about the Pfizer. But as far as what Westside Regional Center is going to provide, whatever we can get our hands on at this point. The first vaccination run that we did, we were contacted. They had Moderna. So we hopefully we will be able to have a greater choice. But right now we're just kind of confined with whatever we can get. And I don't know, Lavisa, I know you wanted to speak on the other issue.
No, I was just going to say exactly what you said, that I don't think there is a choice at this point. The other thing is that there is still the cold chain that is needed. That is most likely going to be like Moderna for Pfizer, but not at this point. So I think we don't have a choice for now in terms of what vaccines we can get.
There's a question from someone asking, is it better for you to eat something before the vaccine?
it's always a good idea to do that. And there is, as I always tell people to eat and drink before they come in. There is something that we see quite frequently, actually. I just saw one in clinic a couple of days ago, is a vasovagal response. It's basically when people pass out, and it's fear. It's basically being dehydrated. And you probably have heard of people passing out when they get a blood draw. So in this kind of scenario, it creates a confusion because we are concerned about a reaction to the vaccine. So definitely, yes, eat and drink before you come in.
Is there any benefit to weekly testing for unvaccinated people?
I mean, ideally everybody should be vaccinated. I don't know if it makes that much sense, because the best test that we have is the nasopharyngeal swab. There are other tests that aren't as good. There's a mouth test and different kinds of tests. So putting someone through that discomfort on a weekly basis when there is no clear contraindication to actually getting a vaccine, which would prevent the need for all of this testing, it's better to get the vaccine and not test every week.
There is a question about if someone is, wearing their mask, is constantly washing their hands, remains at home, gets their groceries delivered to their home, do they need to get the vaccine?
It just takes one exposure to somebody who you may not know is infected. And if you're vulnerable and it's that one exposure that can cause the disease, I still would strongly recommend getting vaccinated, because you cannot prevent everything even by these means. It still needed the vaccine, despite the fact that people can mask and isolate unless you stay in one room for the next few years. This virus is here to stay for a while. So isolating is not going to do the job.
There's a question about when will someone be notified if they're able to get the vaccine? Like, is there a system that they can use to sign up to get notified when it's their turn?
I'll be honest, and Sandy, you may even be able to speak to this. I have had not enough experience with myself registering or hearing from folks. My understanding is you just, at this point, is you go on and you make an appointment. Unfortunately, I know other counties like Long Beach, I heard some folks where you just sign up and then they just contact you, but I don't think that's happening right now in LA County. As Sandy, you've had a little bit more experience with this. Do you have any idea about that?
I know that I think it's called myturn.gov, .California. If you sign up, you can fill out your age, characteristics about like where you work and stuff like that. And they should send you an email. LA County will send you an email saying, you are next, you're on the tier system to be eligible for a vaccination. So that's one way to get notified when it's your turn to get the vaccine, is to sign up. You can always visit vaccinatelacounty.com. And what they'll do is that you can sign up for their newsletter, and you can also find updates about, who is in the next tier to get vaccinated.
Thanks, Sandy. I kind of feel like I should be in the audience at this point.
Oh, there is a question about how can people with intellectual developmental disabilities access the Johnson & Johnson vaccine?
I'm not sure that we know the answer to that, but I do think that that's a very, very reasonable choice for our folks to have a single dose. And I think to all the points that Tom made, having two doses, needle phobias, behavioral issues, it's really important. And I think we may need to end up advocating for that, because that's, in my opinion, a very good choice for a lot of our patients or our folks. So.
if Tom, if you can recap about that, if you're currently an IHSS worker, how they can schedule an appointment to get the vaccine, or where would they be going to get their vaccine?
So you would just identify that you're a healthcare worker. You would go to the sites that we identified. You would identify that you're a healthcare worker, and what you would, I think what people have been providing, you could provide a letter verifying that the individual that you're supporting is a regional center. And they're usually, what seems to work the most is that if you have some kind of like pay stub or payment receipt, something that shows that you're a paid IHSS worker.
I was just going to put in a plug for Achievable on this, because Achievable Clinic, which is in the same building that the regional center is in, we have had a lot of IHSS providers come in and get vaccinated. So you can always call the clinic and ask them when their next vaccine is going to be available, and you could get it that way.
There's a question about how long after I no longer show symptoms of COVID-19 am I allowed to get an appointment for the COVID vaccine?
So there isn't any specific clear recommendation as to how long, but we do think that you have protection for about 3 months or so. So they, in the beginning, the idea was that we should let others be vaccinated, but you could get vaccinated at any time. There isn't any specific time period, but you do have protection for about 3 months that we feel comfortable with, that you will not get an infection. So any time after you are fine, you can get the vaccine.
And I guess just to recap for those of you who may have joined late, we will be sharing these PowerPoint slides for everyone who has registered for this webinar. This is also being recorded, so you will get a copy. And for those of you that are Spanish speaking, our interpreter agency, CRS, will be giving us a link and password so that you can listen to this webinar in Spanish. We will also be translating these slides into Spanish so that you can review them at home or with your family and loved ones. But yeah, I think that's it for now, Tom.
All right, well, fantastic. And thank you so much. Thank you, Lavisa, Dr. Body. Thank you, Sandy. Thank you to our interpreters, as always. You guys have been phenomenal. Thank you, Janine, for helping to facilitate as well. And thanks everybody for joining us. So thank you.
Thank you.